Hip dysplasia is a word that can send a shiver of worry through any dog owner, especially those with larger breeds. Put simply, it is a developmental problem of the hip joint. A healthy hip works like a smooth ball fitting snugly into a deep socket. In a dog with hip dysplasia, this perfect fit is missing. The socket might be too shallow. The ball part of the femur might be misshapen. Because of this poor construction, the joint becomes loose and unstable. It is not something the dog catches like a cold. It develops as they grow from a puppy into an adult. This is why early understanding is so important for long-term comfort. This looseness, or joint laxity, is the root of the trouble that follows. Every time your dog runs, walks, or even just stands up, the unstable joint allows the ball to slide around improperly within the socket. This constant abnormal movement causes friction and stress on the joint structures. The smooth cartilage that lines the joint surfaces begins to wear down, much like the tread on a tire wears away with every mile driven. This gradual damage is painful and sets the stage for a much bigger, chronic problem. The body's natural response to this instability and damage is inflammation, which leads to the painful condition we call osteoarthritis. Beyond bad genes, the causes you can control. It is widely known that genetics play a starring role in the story of hip dysplasia. The condition is hereditary, meaning the risk is passed down from parents to puppies through a complex web of different genes. This is why responsible breeders are so diligent about screening their breeding dogs for hip health. If a dog's parents and grandparents have certified healthy hips, the puppy's chances of developing the disease are significantly lower. However, blaming genetics alone is seeing only part of the picture. Think of genes as loading the gun. It is the environment and lifestyle factors that often pull the trigger, determining how severe the condition becomes. One of the most critical environmental factors is the rate of growth during puppyhood, particularly in large and giant breeds. These puppies are genetically programmed to grow very, very fast. If their diet is too high in calories, it can accelerate this growth beyond what their immature skeleton can handle. The bones grow faster than the supporting muscles and soft tissues, putting immense strain on developing joints like the hips. An improper balance of minerals, especially calcium and phosphorus, can also disrupt healthy bone formation. Feeding a specially formulated large breed puppy food, a picture of proof how your vet diagnoses hip issues. When you or your veterinarian suspect hip dysplasia, the diagnosis is not made on a hunch. It requires a clear look inside the joint. The gold standard is radiography, X-rays. Your vet will start with a physical exam, manipulating the hind legs to feel for looseness, listening for clicking sounds, gauging your dog's pain response. But that hands-on check only suggests a problem. To confirm and plan treatment, your dog will need sedation or anesthesia. Then precise, high-quality X-rays of the pelvis and hips are taken. There are two primary evaluation methods, OFA and PenHip. OFA is the traditional approach, one single, specifically positioned, extended view X-ray. While you cannot rewrite your dog's genetic code, the power to influence their hip health is very much in your hands. Prevention is always better than treatment. The steps you take during your dog's formative months can have a lifelong impact. It all begins before you even bring your puppy home. The most crucial first step is to choose a responsible breeder. A reputable breeder will be transparent about the health of their dogs. They should willingly provide OFA or PenHip certification results. Ask specifically for documentation for the dam, the mother. Ask specifically for documentation for the sire, the father. By selecting parents with proven good hips, you stack the genetic deck in your favor. Once your puppy is home, focus immediately on diet. Rapid growth is a major enemy of developing joints. Feed a high-quality food formulated for large breed puppies. These formulas are less calorie-dense. They have a balanced calcium to phosphorus ratio to slow skeletal growth. Avoid overfeeding. While hip dysplasia can technically affect any dog, including small breeds and mixed breeds, it is overwhelmingly a problem associated with medium to large and giant-sized dogs. The combination of their genetic predispositions and rapid growth rates creates a perfect storm for this developmental joint disease. Knowing if your chosen breed is on the high-risk list allows you to be extra vigilant from day one. focusing heavily on preventive measures like diet, exercise, and breeder selection. It is not a reason to avoid these wonderful breeds, but rather a call to be an educated and proactive owner who understands their dog's specific needs. Among the most famously affected breeds are the German Shepherd Dog, Labrador Retriever, Golden Retriever. These breeds are consistently at the top of the list for incidents of hip dysplasia. Their popularity means they are bred in large numbers. When a dog is diagnosed with hip dysplasia, the goal of treatment is to relieve pain, improve function, slow the progression of arthritis. The right path depends on many factors, including age, size, severity of the disease, degree of pain they are experiencing. For many dogs, especially mild to moderate cases, the first line is conservative, non-surgical management. This isn't a single cure. It's a collection of strategies to keep the dog comfortable and mobile. The cornerstone is strict weight control. Reducing load on painful joints often helps more than any single medication. Alongside weight control, vets will likely prescribe pain meds. NSAIDs are commonly used to reduce joint inflammation and pain. Gabapentin may be added for chronic nerve-related pain. Amantadine may also be used for nerve-related pain. Only use medications prescribed by your vet. Human pain relievers can be toxic. Choosing surgery for your dog is a major decision, and the success depends just as much on the post-operative care you provide at home as on the surgeon's skill. The recovery period is long, demanding, and requires your absolute commitment. The initial phase, typically the first 6 to 8 weeks, is the most critical. Your dog's activity must be severely restricted to allow bones and tissues to heal. Strict confinement to a crate whenever unsupervised, or a small puppy-proofed room when you can't directly supervise them. No running, no jumping, no playing with other pets. Outdoor trips only for elimination. Keep your dog on a short leash at all times. You may need a special sling to support the hind end on steps, or a harness to stabilize them on slippery surfaces. This helps prevent falls and takes weight off the healing limb.